Hi, my name is Dr. Ami Dakshini. I'm a dermatologist and I practice in Bangalore in my clinic called Think Skin Clinic. Today, I'm going to talk about something very, very important for all dermatologists and all of you who are interested in dermal fillers. I'm going to talk about the temple rejuvenation. Now, why do I say it's important is because in Indian faces like ours and other Southeastern faces, we always tend to go depressed here as we age. The volume starts reducing and that causes the eyebrow and the eyelids to start drooping and we look very tired around the eyes. This also helps in giving the lift to our midface. So when the temples start receding in volume, our midface starts sagging. So the temple rejuvenation not only helps in opening up our eyes, but also giving us a natural look of our midface lift. Now what do we do? Like I say, I love to train and I go all around the country training doctors. Let me start with very simple and basic things. The first of it is anatomy. So let's look at the anatomy of the face, and I welcome Gigi today, who's going to demonstrate the anatomy of the temple area. Now let's get into a little bit of details. What is the temple area? The temple is anatomically marked by the temporal crest here. This is what you feel when you move your fingers laterally towards the eyebrows. Your orbital rim, that is your lateral rim around the eyebrow, and here it's the zygoma, the top part of it. So this area essentially is called the temple. Now in this area, the important things that we need to note is not just the vascular supply, but the layers that are present. In the rest of our face, there are almost 5 layers starting from the skin right to the bone. But in the temple area, we have 10 layers and they are these. Now when we inject in this area, as all dermatologists would know, we would essentially inject onto the bone, that is supraperiosteal, so that we get the perfect lift. One of the reasons was because there is a great arterial vasculature anastomosis that happens in this area, and they directly connect to the eye, and we do not want any case of blindness. But now we've realized with ultrasound, which is a very wonderful way to understand the vasculature in that particular area, as well as understanding more about the depth and the layers of the skin on the temple area, that we now can inject in 2 different ways. Let me go into detail. The first way, which we all would inject, was the gunshot way. That's how we all got trained and gave us wonderful results. But sometimes we would notice not as good as we would like it. In the gunshot way, we would directly inject onto the bone, feel the temporal crest, go 1 to 1.5 centimeter up and similar laterally, and give it like a gunshot right facing the other eye. This we inject a filler which is very high in G prime on the bone, giving an implant effect and lifting the entire skin to give us a wonderful eyebrow lift, as well as a mid-cheek lift. But then we realized that there was also loss of volume around this area, which would not be able to fill up. Try if you could push this high G prime filler around. It's practically impossible. And that's when we all started injecting in the subcutaneous area. Now the thing to remember in the subcutaneous area is that it is extremely superficial. So when you go superficial, there is tendency of feeling the filler, and many a times if the patient sits with her hand rested on the temple area, there could be depressions. That's when we realize that we need to do a newer technique, which we've just learned and I want to share with all of you. But before that, let's just quickly look at the arterial supply in this area that we have to be really careful about. So as we all know, the arterial supply of the temple, the most important being the superficial temporal artery that comes up here. It anastomoses with the supratrochlear and the supraorbital, and therefore we have to be very careful. But remember, it's along the hairline. And then you have the branches of the supratrochlear and supraorbital coming along it, but they are much more superficial. So the area that is absolutely safe is this area. Yeah. So as I said, the first way is the gunshot. So the second way, which we've currently learned, and it's very interesting, is to inject into the intrafascial area, right, entering the cannula right below the temporal crest, not in the subcutaneous tissue, but in the interfascial plane. Now, how does one reach that plane? It's very simple. When you put in your needle before you enter with the cannula, you hear the first pop. That's when you've gone into the subcutaneous tissue. Push in further. You will hear a second give way or a second pop. That's when you are in the interfascial plane. And that's the right plane to get in with your cannula. I prefer to do with a 22 or a 23 gauge cannula and inject in this direction. So if you see, you fan in from the point of injection all around to raise the entire temple area, with the base being your high G prime filler, which you've put in right in that point. Now, to tell you about the specifics over here, remember, always inject your higher G prime filler first. So your gunshot is first, and then relocate your temporal crest, make a point in the midline of that, and then your 2 pops before you enter with your 23 or 22 gauge cannula and fill the filler, which is lower in G prime. So you use the medium one. If you know that the depression is much more, you use a little lighter one if the depression is not as much. So this is the right technique now that we all doctors employ to fill up the temple area, so we see great results. Couple of things that I wanted to speak to you before you start doing this. Remember, in some patients, the temporal crest as well as the orbital rim are very sharp and the depression is just very sudden. So remember to go a little more medially to cover and round off that area, because all of us want natural results. And the second important thing that you need to remember when you're doing this is that when you're doing with the needle, the gunshot, do not forget to aspirate. And when you aspirate the air up to 0.2 in your syringe and keep it for 10 to 15 seconds before you decide to inject. I would prefer the ultrasound method, which most of us doctors have now been using. So you can exactly locate the artery, feel the pulsation, know what you need to avoid, and then start filling your temple area. I hope this has helped you, everyone. In case you have any questions regarding the temple or any other fillers, feel free to write to me and I will answer back as much as I can. Thank you very much, and be in touch and look out further videos where I talk about other face fillers so that it helps you in your practice.